Screening tests are really important. The purpose of screening tests is to detect problems early so that they're very treatable. Otherwise, if we let things go too long, then they become really problematic for the patient and can even be life-threatening. There are many different screenings recommended for women. Let's talk about mammograms first. Recently, the guidelines have changed, suggesting that women between 40 and 50 can go every other year for their mammograms, while women over the age of 50 should go every year. I personally recommend that my patients go every year for their mammogram starting at age 40. It may be different for your doctor, so I would talk to your doctor about what they recommend for you. In addition, if you have any history of breast cancer personally or in your family, your guidelines may be different, so you need to talk to your doctor about that as well. So another screening test to talk about is cervical cancer screening, or the Pap test. Many women believe that the Pap test is screening for ovarian cancer and uterine cancer as well, but this isn't true. All we're testing for is cervical cancer. Recently, the guidelines for cervical cancer screening have changed as well. What we do know today is that the vast majority of cervical cancers are caused by the human papillomavirus. There's only a very small subset that are not. So, if you have never had an abnormal Pap smear and you have a test for the human papillomavirus, which is recommended for women between the ages of 30 and 65, then you're at very low risk for developing cervical cancer, and it's okay for you to have this test done every 3 years. This doesn't mean that you shouldn't see your gynecologist every year, because there's other things that we're looking for in your exam as well. Healthcare really is a partnership. My job to be a good physician is to stay up to date with all the current recommendations on screening. I can tell my patients what they need to do, but then my patients need to follow through.